Hi, I'm Dr. Lewis Clark. I want to talk to you today about a symptom and a condition, unfortunately, that is increasing greatly in America. It's called diabetes. Specifically, I want to talk about type 2 diabetes. You may be aware that diabetes has increased over 39% in the last 2 years alone. And unfortunately, the treatments that are being offered at this point are doing nothing to stop, prevent, or even control the symptoms and the advancement of the condition. So I want to tell you a little bit about our approach in our office, about my training. And so we take in our office a neuro metabolic approach. And my training, as you can see here, I'm a board certified chiropractic physician. Also, I'm board certified in chiropractic wellness, board certified in integrative medicine, and a certified gluten practitioner. My studies include advanced study in functional neurology and functional nutrition and functional medicine. So, what is diabetes? Let's talk about that for a few minutes. You're probably familiar with the fact that it involves glucose or blood sugar problems, okay? But there's different types and different level of blood sugar problems. So we're going to define them, talk about some things to help you understand that there is hope with these things and that you can improve and you're not stuck with the problem that you have. Now, I want to say this first of all, just to make sure you understand this. The problem with diabetes, insulin resistance, and symptom X, and all these different things is that blood sugar is too high in the blood and it's not able to get into the cells where it can be used. So what transports the insulin into the cells, the blood sugar or glucose into the cells, is insulin. And so insulin is a very important factor that we're going to talk about. So in order to be diagnosed as a diabetic, you have to have a blood sugar level over, fasting blood sugar level over 126. If you have 125, does that mean you don't have any problems? No, that just means that you're not diabetic. You must be diagnosed with a fasting blood glucose level over 126 at least twice in order to be diagnosed as a diabetic. Now, if you have a blood glucose level below 126, okay, you still have blood sugar problems. And you may or may not be prescribed some of these prescriptions like insulin or metformin or some of the other drugs that are used to lower glucose levels. And unfortunately, besides that, in the standard model today, there's not much else done except for maybe slight recommendations about getting more exercise and maybe watching your diet. And that's not specific enough. So we're going to go into that a little bit later. This will not, unfortunately, do anything about the cause of the diabetes or the insulin-resistant problems. So what we're going to talk about will not only help you to identify what the cause may be, but also how to deal with it. So the current model is insurance-driven. It's not designed based on function, and it's unfortunately profit-driven because it's all based mostly on drug prescriptions. And so unfortunately, the pharmaceuticals are in the business of making money, as you know. So the diabetes, therefore, is progressive. And that's what you can typically expect with this type of model. So it's time for a change. And so the risk of type 2 diabetes, okay, and go through this for a second. You're probably aware of this, but it's very important that you understand this progressive illness will not stop with just elevated blood sugar. End-stage renal failure, kidney failure, and dialysis is a risk with diabetes, and especially type 2 or any type of diabetes. Heart disease is increased 2 to 4 times higher in adults with diabetes. Nerve disease like peripheral neuropathies, as you know, increase greatly with diabetes. Also, we have amputation. Unfortunately, happens very commonly, 10 times higher with diabetics. Blindness is also very common and more likely in diabetics. And lastly, we've got an increase of all different types of cancer. because when you increase insulin levels, you increase division of cells, and you're more likely to have an error and develop a cancer cell that may spread. So those are some of the risks that go on because of diabetes. Now, I want to tell you this, diabetes has now become the 7th leading cause of death in America. And here's the sad and the good part. It's completely preventable. And I'm going to talk to you about how to do that. Type 2 diabetes is completely preventable and reversible in most cases. You may be surprised to hear that because you've never heard that, and it's not possible with drugs. You're going to have other things involved, but we're going to have to get to the cause. Remember back a few minutes ago we said, what does the standard model do about the cause? Nothing. And rarely is it ever attempted to even identify what may be causing the diabetes. So I'm going to talk to you about some of the problems here. These are some things that can be affecting your blood sugar levels. Things like adrenal function. Adrenal gland produces cortisol, and cortisol helps to regulate blood sugar. Also, autoimmune conditions. People think of type 1 diabetes being an autoimmune condition, but they don't realize that a large percentage of type 2 or adult onset diabetes is also autoimmune or has an autoimmune component. And there's ways that you can test for that, okay? One test is to do the GAD antibody. You can also test insulin antibodies. You can also look at other areas that may be affected. You can have food allergies and sensitivities that begin to cause your blood sugar to go up. You can also have liver dysfunction, chronic infections, and of course, diet and stress are all factors that affect your blood sugar. So the bottom line is the underlying cause must be detected, it must be properly tested for, and then the proper treatment can be recommended and prescribed in order to reverse the condition. What about diet? People, generally you just get eat a better diet, eat a balanced diet. That's not specific enough. In order to know, you have to know what foods you may be reacting to, what foods are okay for you to eat, how many carbs can you handle to still keep your blood sugar within that normal range. Those are all factors that must be identified to set the proper diet for you. The other thing, what about nutritional deficiencies? Is it possible that you have a nutritional deficiency driving your diabetes? Absolutely. As a matter of fact, a large percentage of Americans, even though we take in an abundance of calories, they are nutrient deficient calories, and so therefore we end up with vitamin and mineral and other deficiencies. And so how do you change that? Well, diet can make a big difference, but also sometimes you're going to need to use bionutritional whole food supplementation until your body becomes sufficient. Supplements that may help, for instance, the receptors of the cells become sensitive to insulin again. If you've developed diabetes or insulin resistance, your cells have now become resistant to insulin. That causes your blood sugar to stay higher. So there are certain nutrients that can begin to make those cells receptive to the insulin again and begin to get the blood sugar back in the cells where your body needs it. The other thing that we must talk about, of course, is there are going to be some lifestyle changes that you need to make. If you're not committed to making lifestyle changes, then at this point you're probably just not sick enough to get better. Because any reversal, stopping of progression, or improvement is going to involve some changes. And then the other thing is we must always know that we've got to test neurologically as well as metabolically, because remember, your brain runs and coordinates everything. So therefore, if you have a brain imbalance or a deficiency, and by the way, the first thing that's going to be affected because of insulin or blood sugar changes is going to be your brain. So your brain's going to begin to decrease in function. You may have things like brain fog or short-term memory issues, or you may have depression, which is a very common problem, or even anxiety, insomnia. These are all brain regulation issues, and they must be addressed. So in our office, we do a thorough neurologic evaluation as well as a thorough metabolic evaluation, looking at not only your glucose level, not only your HA1C levels, but other underlying causes for these problems, like what's going on with your adrenal function, your cortisol levels, your thyroid function. Do you have an autoimmune condition? Do you have a hormone imbalance? Do you have a food sensitivity, or is there something else going on that may be causing this? If you don't do that, you may never get to the underlying cause. And so, in our office, this is a 2-day process. And I'm going to talk to you about what we do. On the first day, we do our thorough evaluation. This involves reviewing all of your blood work that you've already had done, doing a complete neurologic evaluation, filling out thorough metabolic assessment forms, neurologic assessment forms, reviewing all of those things along with your history, and sitting down and really listening to what's going on with your history and with your condition. Then day 2, we sit down and we go over this. Now, day 2 is where I tell you, number 1, if I can accept you as a patient in the office or not. Are you a candidate for neurometabolic recovery from diabetes program? And if you are, then we'll go over our best recommendations for further testing if needed, for diet recommendations, for neurologic care if needed, for other metabolic treatments that may be needed. If nutritional supplementation is needed, we'll go through all of those things with you piece by piece and explain to you how much it's going to cost, how long is it going to take, and what are you going to need to do. And I'll tell you this right now, if you expect your insurance company to pay for that, you're going to be sadly mistaken. Insurance companies rarely pay for advanced care. That's why you've only received the care that you've received up to this point, is because that's what the insurance companies pay for, the bare minimum. Matter of fact, they're paying for things that we were doing back in 1970 and 1980, and not the things that we've learned in the past 5 and 10 years that have really advanced and allowed us to get better results. So, my special offer in that case to find out if I can help you is I'll do the first 2 days, which normally is going to cost you $285, okay? If you see this video and you want to come in and see if you can be helped, I will do the first visit for just $95. And that'll include the thorough, both days. Me going over your thorough exam, all of your assessment forms, reviewing your blood work, and then day 2, giving you a report with your spouse about if you can be accepted, what we should do, what you need to do, and how long it's going to take and how much it's going to cost. And I'll say this about cost. Almost anybody can afford our care. If you can afford to pay $200 to $300 a month for the next 12 to 18 months, then you can afford to get better. And so just keep that in mind. So if you have further questions, or if you'd like to come into the office to make an appointment, you can either call us at Clark Chiropractic and Wellness at 281-354-8330, or you can go online and check us out on the web at clarkchiropractic.net. I want to thank you for your time watching this video, and I look forward to seeing you in the office. God bless you, and have a great day.